Welcome back. Today we're talking about something every clinician faces, and often not very confidently: choosing a job, evaluating an offer, and signing a contract. The anesthesia market is changing fast. Private equity ownership, staff volatility, reimbursement shifts, and a wide range of compensation models make it hard to know what's sustainable. We're going to talk openly about red flags, green flags, questions you should be asking, and how to avoid learning lessons the hard way. Because a great job isn't about the salary, it's about autonomy, respect, culture, and continuity. Welcome to Unmasked, the CCI Anesthesia podcast, the show where we dive deep into the world of anesthesia practice improvement, quality enhancement, and the evolving landscape of healthcare. I'm Doug Simpler, your guide on this journey as we explore the strategies, innovations, and stories that shape the future of anesthesia care. Get ready to be enlightened, inspired, and most importantly, unmasked as we unravel the many layers of the current state of anesthesia. This is Unmasked. I'm joined today by two clinicians who have lived through different practice structures and organizational cultures. We're pleased to welcome Sarah Finch, CRNA and Regional Clinical Officer for CCI Anesthesia's Northern Midwest region. Sarah oversees operations in Michigan and Ohio and also serves as Chief CRNA in Three Rivers, Michigan. With her experience in anesthesia and non-surgical pain management and her passion for mentoring clinicians, supporting wellness, and building strong clinical teams, Sarah brings a thoughtful and grounded leadership perspective to the panel. Welcome, Sarah.
Thank you. Glad to be here.
Also with us is Sean Bitz, CRNA and Vice President of Clinical Affairs at CCI Anesthesia. Sean has served for 8 years at Union Health in Terre Haute, Indiana, including 4 as Chief CRNA, and is widely respected for his collaborative leadership style and innovative approach to patient care. Sean also serves on the board of directors for the Indiana Association of Nurse Anesthetists, actively shaping the future of the profession in his state. We're thrilled to have his voice and perspective with us today. Thanks for joining us, Sean.
Thank you, Doug. Glad to be here.
To kick things off, Sarah, what's the biggest misconception clinicians have when evaluating a job offer?
Job offers not just how many hours am I working, how many days am I working, how much call am I taking, and how much money am I making. There's a lot more to it. You have to look at the aspect of what kind of practice am I going to be in? Do I enjoy the case mix that we have? How many other clinicians are there with me every day? What kind of support do I have on a regular basis? Does this put me in a location that I want to be? Does it provide my family with the financial resources to achieve our family goals? And does it give me enough balance between home, work? And are there opportunities to grow? Depends on where you want to take your career and what type of aspects that position could offer you.
Sean, what did you get wrong when you signed your first contract?
Well, when I first graduated anesthesia school, I was just ready to get out into the field and start making money and dive into the profession. I really didn't put a lot of thought into the contract. I just kind of went with whatever the offer was. I didn't realize that I was sort of in control at that point of my future. I thought more that I just kind of had to accept whatever was offered on the table.
What contract red flag do you wish more CRNAs recognized?
I think vague language is a red flag. Words like as needed, it really puts you on the hook for unspecified or undefined times. So on that note, I think it's important to have as much definition as possible in it. I think that it has to be approached within reason. A contract is to protect all parties, the provider included. And so looking at that through a reasonable lens is imperative. Don't feel necessarily like the other party is out to get you, but they do need to protect their own interests as well as you need to protect your own, and the contract should reflect that.
How do you spot an unstable anesthesia practice?
I think the best way to do that is market analysis and the aspect of your own market analysis. Why do they need a provider? What has happened that has made them have an opening? Was it a long-term CRNA was there for 25 years and they've decided it's time to retire and they're looking to replace that CRNA? Or is there a lot of unrest? There's a lot of mass exodus of other providers. I think that's one of the big components of how stable it can be. Also, how long has the anesthesia group been there? Are they a reputable company? Are you contracted with the hospital? What do those dynamics look like?
Clinical stability can also be identified within the entire OR by talking to the anesthesia providers and getting a sense for the flow of a given day. Some consistency goes a long way with providers. So knowing, for the most part, what your days are going to look like, how many rooms are staffed each day. If you get an inconsistent answer on that, like however many rooms we can run, those are answers that lead to less consistency and less stability in a practice.
And you can figure that out by when you're looking at a contract and you've had your initial interview and you've been offered a site visit, take that site visit. That's your opportunity to actually get into the facility, get into the OR, talk to the providers, see how the interactions happen between OR staff and anesthesia and surgeons. What are the dynamics between the OR director and the lead of anesthesia? All those things will help you kind of really figure out what is the culture there.
A lot of groups talk about work-life balance and clinical autonomy. What's the difference between marketed clinical autonomy and work-life balance and true clinical autonomy and work-life balance?
I think a lot of that depends on you as a provider and what you're looking for. CCI, we offer a lot of different options as far as contracts are concerned. How much call you take, if you take call, how many weeks off you have, what type of rotation you have. Those things are all really, really vast options within CCI. And I think that offers us a lot of balance as far as what are you looking for? Are you brand new out of school and you're just looking to work and make money and pay off debt and you don't really care how much time you have off because at this moment in your life, that's not what you're looking for, versus you're married and you have children and you want to be able to get to every Tuesday night softball league. There's different dynamics. So I think really diving into what the contract can offer you based off of what you're really looking for within your life.
Question for you both. What questions should clinicians ask before signing a contract?
I think that can be different for leadership versus clinicians. I think if you're interviewing and you want to ask the leadership specific questions about how do they handle conflict within the department, how do they make the schedule, what are policies and procedures that will pertain to them, those are important leadership conversations. The actual clinicians that you're meeting with that day, ask the things kind of like what Sean and I have already been discussing. Do you feel respected? How does your leader support you? Do you feel well respected by the surgeons? Do you feel supported by the operating room staff? What is your dynamic like every day? Are you happy at your job? I know it seems like a very simple question, but people usually will be quite honest with you.
Yeah, in determining, are you a temporary or locum contractor or employee, or have you been here a while? And speak to the nurses. They know what's going on in those ORs. They know their providers. They know the surgeons. They know the respect that's offered amongst all parties. And they'll tell you too. They'll be happy to tell you most of the time.
Oh, yeah.
What are some of the hidden deal breakers that many clinicians ignore?
I think sometimes people are willing to compromise what they truly want out of a position at the beginning, thinking that it might change. And you should probably take what you're being presented at you at face value. If the providers say, I know administration says we get out of here by 3:00 every day, but we don't. We work till 4, 5, 6, and Thursdays we work till 8. Take that for what it's worth. Don't overlook that because you're being told by someone other than the actual providers doing the work that that's not how it happens. I think that that's something valuable to think of when you're moving forward. Don't overlook little things because the little things become big things.
Yeah. And, is there a structure to the job? Do we run X amount of rooms until 3 and then go down to a certain amount of rooms until 5? How is that managed? Who makes the decision? And do we have anesthesia leadership that will stand up for that structuring to make sure that it's being followed? That's a double-edged sword. because if all the providers know that we're supposed to go down to a certain amount of rooms at 3, that is the expectation. And we all know things happen in an operating room. We don't turn off the machines at 3:00, and when we have patients that we're taking care of. So again, having a reasonable outlook is super important as a provider, but knowing that you're going to have representation when guidelines are being abused consistently, keyword consistently, that makes a huge difference in work-life balance and overall satisfaction in the job.
Culture is commonly known as the silent compensation, and culture can make or break clinical satisfaction. Sean, how do you evaluate a culture of a facility before you're actually in the door?
It's all about the people. In our specific practice, we have an excellent group of CRNAs and docs that just work together, and we have free conversation and free thinking in terms of how do we tackle this scenario, or can you help me through these guidelines? Or we're not perfect. We don't remember every single guideline that might be out there for every specific disease or medical process, but within the group, there's very likely a resource that can be used to tackle the issue at hand and move forward.
How can you tell if a group is burnt out when you're still interviewing?
Ask them. Most of us as providers are pretty open and honest about that. You can ask on your site visit, do you feel like you're overworked? Do you feel like you work more than the expectations that were set before you? I think those are big indicators. And if you notice that your volume is increased, you are working more, you're all starting to feel a little on edge, definitely feeling more fatigued, more tired, that's something that then you work together as a group to fix going forward. Go back to administration, show data, case volumes changing, those types of things. And that's when you reevaluate about how many providers do you have, what type of hours are you keeping, what's the expectations of the OR.
And when a culture is not good, how does that impact job satisfaction and also patient care?
Oh, hugely. I think when you enjoy coming to work every day, you're a more pleasant person, you're a better team player. Patients pick up on that. People oftentimes in our facility are like, you guys are way too happy to be here. We're like, no, this is just our job and we enjoy taking care of people. They see that we smile at the patients and we laugh and we joke around with them in a professional manner just to kind of ease the tensions. Culture's huge. I think culture comes from leadership down. And I think that culture is something that should be instilled at the interview, at the beginning process of this is our expectations and how we expect you to be as a part of our team. So I think starting from the very beginning kind of helps keep that culture consistent.
You both have leadership positions at CCI managed facilities. Could you describe the culture at CCI Anesthesia?
I love working for CCI Anesthesia. It's a culture like I've never had before in anesthesia. I've been practicing almost 15 years, and I have left a position due to lack of culture and lack of listening when the providers were explaining what was needed, what wasn't working, and that not being addressed versus with CCI, they're very open. We set expectations from the beginning for our providers of what our culture is here. We're very focused on providers, people, how we take care of patients, integrity, and that's one of the best things about CCI. I've never been in a situation within this company that I felt it wasn't handled with the utmost respect and integrity and being patient-focused as well as provider-focused.
Yeah, CCI just continues to be provider-focused. They're not feeding third-party mouths, so to speak, with like private equity and venture capital type investors. So all of the resources go to anesthesia. And so that can be proliferating the medical affairs team. That's Sarah and I are both a part of, and which is essentially comprised of clinical leaders that can be a resource for every other site within CCI. Having that clinical piece can really make a provider feel more comfortable that they're working with an anesthesia group that cares about our interests as providers and how we can best care for patients. They value work-life balance by offering ample time away from the practice. And then there's many different practices within CCI, from larger facilities with just about every case type you can imagine to, one provider shops.
Obviously, you're both sought after clinicians. Why do you choose to spend your career at CCI Anesthesia?
Yeah, I'm staying with CCI because of the culture, as Sarah mentioned. It's just a great place to work, especially for a CRNA that values autonomy. From every high-level leader within the company, you'll hear them talk about CRNAs and anesthesiologists for that matter, working to the top of our licenses. It seems to just be so obvious, but across the country, it's just not like that. For whatever reason, that's not empowered within the clinical providers. And so that's a message I feel passionately about. It's a message I can help expand and spread, to the other practices across the country. And so, yeah, I can't imagine going backwards at this point.
Yeah. I feel very supported as a provider. And I have been within the company, I've been promoted within leadership. I've been appreciated for not only my clinical skills, but my leadership abilities. And I think it's important when a company recognizes you for the hard work that you do, and it makes you want to work harder for that company. And I don't foresee myself leaving.
How would you both say that CCI is different from other anesthesia management organizations?
I think it's really hard to work for a lot of the other companies out there that make you feel like you're just a number on the list. There isn't that personal interaction. If I have any sort of question, concern, I can call anybody in our chain of command and they will pick up the phone and they will talk to me, from the CEO and owner of the company all the way down to the person that I work directly with. Or if I had an issue and Sean could help me, we really work together as a team to really uplift the providers. So I think that's really important.
Yeah, and I haven't worked specifically for any other large anesthesia management companies, but one really great thing about the CRNA community is our interconnectedness. If you're on social media, you'll know that CRNAs across the country band together and support one another in most cases. But you can get on these forums and see some of the other anesthesia management companies that don't have a good reputation. You can accumulate your own thoughts on it based on what everybody's saying. And so it's I'm really proud that CCI has a good reputation within our community.
Mm-hmm.
Before you sign the next contract, take a look at CCI's open positions, transparent terms, stable staffing, and outstanding culture. Learn more at ccianesthesia.com. Sarah, how does private equity involvement affect clinicians?
I think personally, private equity can increase when something is unstable because you have an additional party that you're having to interact with, and what will change the dynamic of what you can do and what you can't do. And within CCI, we don't have any of that. And so the company itself can really focus on kind of what Sean was saying earlier. We really focus on the provider, which allows us to provide great anesthesia to our patients and do it well.
Yeah, we're not only partnering with these facilities during the good times, we're there in the bad. And so when there are private investors to keep afloat, so to speak, during those bad times, someone's going to suffer. And so it's usually not going to be those private investors. So as a clinician, I want to know that I'm going to be taken care of. I want to know that we're going to be able to weather the storm and come out of those difficult moments and work together to get through that and not have that third party to to consume the resources.
Do you feel like private equity creates instability in anesthesia?
I do. Yeah. Yeah. I think as providers, it boils down to taking care of patients. That is why we all are here. We want to take care of people to the absolute best of our ability. And unfortunately, I can see an avenue with private equity where that the patient is no longer the priority. Those profits are, and that can be just detrimental to the clinical care.
Sarah, what do you find that true stability looks like in an anesthesia group?
I mean, I'll kind of piggyback off of what Sean said, knowing that you are in a company that is going to be there for you, and that stability of knowing no matter what happens within the practice, you lose a surgeon, someone within your team has a health crisis, whatever the case may be, that you're going to be supported, you're going to be taken care of, and you're still going to be provided those resources to be able to take good care of patients.
Sean, how can clinicians evaluate scheduling predictability?
You can look at the history of cases and know, we're usually doing this many hours of cases a day. And so if you staff that correctly, your providers can know if, generally if they're going to make it to their child's sporting event or be able to make a dentist appointment. If you can't make a dentist appointment in a year because you're constantly overworked, you're probably going to find yourself in a different job.
When you're at that site visit and you're talking to those providers that actually work there, finding out what their workload actually is it something that you're open to and willing to work? And if it's not, explain to the people that you're interviewing with why this doesn't work for you, and making choices not just based off of one or two things, but kind of looking at all the things together as to, am I going to get out of work on time? As Sean said, we work in the operating room. Things change, they flex. Some days you're out when you think you're supposed to, and other days you're still there 3 hours later because you had an emergency situation. We've said multiple times during this, our focus is patient care, and that's always what we're going to put first. But it's based on consistency. Are you consistently getting out on time? Do you consistently have enough staff to properly take care of patients every day? Those are things to evaluate.
Sean, what does autonomy really look like day to day?
Autonomy encompasses decision-making from preoperative evaluation to implementing the correct anesthetic, choosing doses of anesthetics. It sounds so obvious, but these are important things within the OR to be able to function autonomously when you need to, especially, and when patients' lives depend on it. You can find yourself being the only person available for a patient when they're at their absolute most vulnerable, undergoing an anesthetic, and you've got to be able to perform. So the autonomy allows you to become accustomed to that and ultimately take care of patients.
Sarah, how would you say it feels when an organization actually listens to clinicians?
It really empowers you, and it empowers you to take that and run with it. It empowers you to empower other providers, know that you have the support from leadership down to be able to practice to the full scope of your practice, be able to make those decisions on what's best for patient care, and to know that you're going to be fully supported in those decisions.
Sean, how do you protect your own boundaries in a high acuity and high demand setting?
I think knowing your resources, knowing what's available, everyone should know their limits. We all have them, whether they're exactly pertaining to our anesthetic abilities or our emotional capacity to take on a case. And I think knowing those limits allows you to utilize your resources in the best way to move forward in the most productive, efficient, and safest way.
Sean, what is your one non-negotiable when it comes to choosing a new position?
Oh, the one non-negotiable would be respect in the workplace. And so CCI is very big on ensuring mutual respect, ensuring that people work to the top of their license and capabilities. And in fact, it's an expectation.
Sarah, what should every clinician ask themselves before signing a contract?
Does this contract and what is expected of me truly fit what I'm looking for with my goals, both professionally and personally? And will this set me up for success?
And I'll ask you both as a final thought, what's the best advice you can give to anyone evaluating a contract today?
I would just know who you're contracting with. What are their values? Do they have integrity? Are they going to do what's best for the anesthesia provider so that you can best care for patients? And if the answer to those items is yes, then you're probably moving in the right direction.
I think it's important to find out, does the contract as well as who you're contracting with support your goals and aspirations as a provider, both professionally and personally? And if those things all kind of fall in line and they're checking the boxes, then I would say go for it.
Thank you, Sarah, Sean, for your wisdom and insights today. Thank you for being here.
Thank you.
Thank you.
To everyone listening, the best advice I can offer is this. Don't sign a contract for the job you want today. Sign a contract for the life you want 3 years from now. Ask questions. Trust your gut. Evaluate the culture and not just the compensation. And remember, sometimes the most important part of an offer isn't what's printed in the contract. It's what's between the lines. I'm Doug Simpler. This is Unmasked. Thank you for joining us. Unmasked is brought to you by CCI Anesthesia, leaders in anesthesia services for over 20 years. Subscribe to Unmasked, the CCI Anesthesia podcast today so you never miss an episode. For more resources and information, visit the CCI Anesthesia website at ccianesthesia.com. We look forward to having you with us next time as we continue to unveil the remarkable stories and innovations shaping the future of anesthesia care. Until then, stay curious, stay safe, stay informed, and we'll see you next time.